This is the STL Medical Weight Loss Radio Show with Dr. Joe. No more talking, let's go.
Welcome back to the STL Medical Weight Loss Radio Show. I'm your host, Dr. Joseph Moleski, and we're talking about how Drew and other clients have gotten incredible results, been able to maintain their diet through the holidays, and they're preparing themselves for Christmas and New Year's and beyond. I mean, they're going to be entering 2024 healthier, more fit, more just...
Well, yeah. You mentioned holidays. I'm looking forward to Valentine's Day come February.
Woo!
And we're not going to be having chocolate-covered strawberries. We're just going to have strawberries.
Yeah.
Much healthier choices.
Yeah, and I bet you, and we had a conversation at the break, you're trying to get down to 100-pound weight loss by the end of the year.
You are right. That's my goal. It's a steep goal. I think I'll be more like 93-ish before the end of the year. But hey, it's out there now in the world, so we're going to try to get to 100 before January 1.
Yep. And then imagine Valentine's Day, you're going to be, wow, man, it's going to be incredible to see your success over the next couple months. And then, at your year mark, where are you going to be?
It all started with a conversation for me. I've shared it many a times, and we were also discussing during break. If there's a gift card for you, or like if there's a way for people to sponsor someone, how do you have that conversation to be like, what's the gift to give this season? Yeah, the gift is your health. I understand it's an awkward conversation, but I think if you at least make the effort to tell, whether it's yourself and you're honest for yourself and you need it, or if you're having the conversation because you care about someone, just go to them and say, hey, look, I know a guy, I know a plan that's out there.
Get you signed up.
Let me help you.
Yeah, and you could even, it would be so neat, and this is something that I'll have to throw around, but sponsoring somebody where you could go on almost like a GoFundMe and be like, hey, I want to sponsor this person for better health. Maybe that's how we'll do it. So more to come on that, but, we accept gift cards, HSA cards, so it's something that if you have a family member you're wanting to maybe get back on the right track and they just need a little push, be like, hey, I'll pay for half of the first
of the
month.
Deal.
Yeah.
There's ways around this, and that's something to come.
Yeah.
And that's maybe short term or longer term, but coming up soon, you're going to have the Share Your Health community event again in December, and you're going to give away
some Tirzepatide.
Tirzepatide.
Yeah,
that's a great way to do it.
I'm going to try to give away 2 Tirzepatides, which is a $1,200 value.
Wow.
And all you got to do is literally go on Facebook, go to Dr. Joe Moleski, JoeMoleski. You're going to see like my Facebook page. You'll see how to join, or go to STL Med Weight Loss. Scroll down. It'll say Share the Health Community. You just literally join, and then we're going to launch in the next week the date. So stay tuned. And all you got to do is jump on, and we select 2 people on the call, and there's going to be essentially going to be a Q&A. And then we're going to be giving back. I mean, we're going to be helping somebody take that journey, take that step, be courageous, and we're going to just give it to you.
So this show obviously airs on the weekends, Saturdays at 2, and then you have Sundays at 9. But when you have this date, when it's released, I will share it on the morning crew, Monday through Friday with Dan and I. That way people will know there to join, and we'll have you on the show during the morning too to promote this, because this is such an important thing, folks. Your health, it's the most important thing in the world. It's not the car you're driving.
No.
It's not the fast food joint to get your quick fix. Your health is the most important thing.
To bring it up, I just saw, so I'm a hospital physician. I work in a hospital seeing sick patients, admitted for heart attacks, strokes, cancer, diabetes, whatever it may be. And this week I had a 31-year-old with a heart attack.
Wow.
31, and I'm 36. Drew, how old are you again?
30. I'm 34. I'll be 35 in March.
So 31-year-old, younger than me and Drew, had a heart attack. He had a stent placed in his heart, and he's going to be on, I think, 6 new meds at 31.
Well, look at John and Debbie on this weekend lineup that we have here. You've worked with John and Debbie in the past. Yeah. John had a heart attack.
Yes, he did.
When he was he 26?
Yeah, 26.
He was a young dude. I mean, heart attacks can happen if you're not healthy.
Oh yeah.
Don't think it's going to be the 40 or 50-year-old or 70-year-old.
Yeah.
You in your 20s or 30s, you can have a heart attack
Yeah.
if your health is not in line.
Yeah, and I'm happy that there's people our age and are in the 30s that are like, hey, like, I'm recognizing I got a problem.
Yeah.
And I'm recognizing that I can't do it alone. I'm like, wow, that's a big step for people to take. That knowing that, hey, I'm going to be honest with myself. I got a problem. And they're calling in, they're making the appointments. They're like, you know what? I don't want to feel like crap anymore.
My wife.
I just, like, it sounds crude, but I do not want to feel bad anymore.
No, I don't think it's crude at all. That's just the reality.
Yes.
I mean, my wife, she lost her dad when she was 8 years old. And so think about that, put that in perspective. I have an almost 2-year-old. You have 3 girls. I mean, will you want to leave this earth?
No.
When your daughters are 8 years old?
No. My grandfather, he died at 55 when my mom was 18 years old, massive heart attack, diabetes. And I actually look like him. I never met him, but my mom had to go from 18 all the way up to, getting married, walking down the aisle, and,
wow.
Yeah, so it's one of those things where that runs in my family, like high blood pressure, diabetes, strokes, cancer, all runs in my family. Unfortunately, it runs in a lot of people's families.
Sure does.
And so the way to combat that is very simple. Get down in your weight, reduce your risk of chronic disease that leads into the heart attack, strokes, cancer. So I encourage anybody, if you want to stick around for your family and just be that rock for somebody that, hey, I got a lot of people count on me. I got to get myself right. Like, I'm not going to wait, every year and just put it off, schedule this or that takes precedent, whatever it may be that you're purchasing over your health. Because one day you can be 31 years old and sitting there with a heart attack. You'd be like, wow, if I would have done this at 25, maybe I wouldn't be in this position. Or if I would have done this at 45, maybe I wouldn't have been 55 and having
it's a super, super scary reality for some. I feel for the 31-year-old, just like I feel bad for my wife. I mean, still to this day, she doesn't have her dad. She's my wife's 33. Her dad should still be living, but his health wasn't right, and he had a massive heart attack and died when he was in his 30s.
And I would say a lot of these things that we're talking about are preventable.
Sure, absolutely.
Preventable. I mean, you get down on your weight and you're not having the blood pressure issues, not having the prediabetes, not having the metabolic syndrome where your cholesterol is all crazy and it's causing clogging of the arteries. Yes, guys, I'm going to give you a little secret. This medication does that. It reduces your risk of chronic disease. It reduces your risk of elevated, developing what we call metabolic syndrome, which is elevated blood pressure, increased triglycerides, a big waist, and abnormal blood glucose. All those things in a little package lead into heart attack, strokes, and early death in patients. That's why I got into this. I've seen so many clients, so many patients come into the hospital with these acute illnesses that lead to a lot of the times even death. So if I could reverse that, what would I do? And that's what I did. I started STL Medical Weight Loss. I'm really promoting these medications because they are life-changing. I've seen it in my practice, how it literally changes people's lives.